Very good afternoon to all the enthusiastic Vivites who are watching this fabulous Facebook Live series called as Ask the Doctor. Well, today is the beginning of the week, and I'm back again with the wonderful topic of iPulse, the flagship product of IndusViva. It is the super brand of IndusViva. So I welcome you all to this wonderful Facebook Live series again. Well, my dear friends, as a routine, I would like to tell you that please do pose me your questions right now. And you can also pose your questions at a link which will appear at the bottom of the chat box during the session. So you can click to that link and you can send your queries so that you can get your queries answered by the team members. So welcome you all again. A very good afternoon to all the Vivites who are watching me from India, Nepal, Myanmar, Sri Lanka, East Africa, Rwanda and the United States of America. Well, my dear friends, as you all know that, please do host this as watch parties on other social media platforms as well as on the Facebook, so that people who are not able to watch this live can watch the recording of the video and get benefited by this wonderful, awesome wellness products of IndusViva. Well, my dear friends, as you all know that today is iPulse Day, our flagship product. iPulse is my pulse, as I normally say. Well, iPulse is a product which is a holistic combination of 15 antioxidant fruits, of which the major fruit is acai berry. Well, as you all know that iPulse is a wonderful cardio-protective product as well. It is a heart protective product. So today's my talk will be on something which is related to the cardiac protection as well. Well, my dear friends, always I would like to tell one thing in all the FB lives. See, there are two aspects actually that as wellness entrepreneurs we must all follow. One is the root causes of the disease. The second is the disease itself. So wellness products are actually the holistic preventive health supplements. They are called as the preventive or the protective health supplements, which are going to destroy or eliminate the root causes of the disease. So whenever the root causes of the disease are eliminated, automatically the disease itself will be eliminated. This is what the principles of wellness supplements are all about. I hope you got my point clear. On the same lines, the causes of heart failure. See, the American Heart Association has, it has made an article stating that many other heart conditions can ultimately lead to cardiac arrest or heart failure. This was what the point I was actually trying to emphasize in most of the sessions. The root causes of the disease, the root causes of the heart problems are many in numbers. So these are the things which are responsible ultimately for cardiac arrest or heart attack, which means that the cardiac arrest or the heart attack is the end stage of the particular problem. Whereas there are a lot of beginning stages, early stages of the heart disease, which can include your diabetes, which can include your obesity, which can include so many other conditions, which can eventually lead to something like cardiac arrest or the heart attack in the future. This is what is exactly the difference between the root cause of the disease and the disease itself. So whenever you are consuming iPulse on a regular basis, you are trying to control or neutralize the free radicals, which are nothing but the root causes of the disease. So ultimately, eventually, you are controlling or eliminating the disease itself, my dear friends. I hope my point is clear to everybody. So, in fact, the American Heart Association, they say there are some of the reasons which are contributing to this heart failure. The first thing is called as the coronary artery disease. The coronary artery disease is something like this. It might seem a big terminology to you. I will try to simplify these terms and tell you. Whenever your bad cholesterol and your fat deposits in your arteries of the heart, automatically the blood will not reach the heart properly. This will help, this will make a situation like, a scenario like, the fat will clog the pores of the arteries. In the sense, the blockage in the heart will happen because of this particular bad fat. See, the bad fat might be triglycerides, the bad fat may be LDL as well, the low density lipoproteins as well. So all these things will clog the pores or the arteries present inside the heart or block the arteries inside the heart. This is what is exactly called as coronary artery disease. So second one is called as myocardial infarction, which means that whenever an artery which is supplying blood to the heart muscle gets blocked. See, this is a wonderful concept actually. Your heart is actually a muscle. You have muscles here, you have muscles across the body, your tongue is also a muscle, your face has muscles. Similarly, heart is also a muscle. So whenever the artery or the blood vessel which is supplying the blood to the muscles gets blocked, or whenever there is a problem to that particular artery, then you get something called as heart attack. This heart attack is nothing but the muscles of the heart will fail to pump. This is what is called as heart attack, exactly speaking. So going ahead, high blood pressure. Everybody knows what high blood pressure is. So whenever there is uncontrolled high blood pressure, this particular pressure in the blood vessels, see the blood vessels are something like a narrow tubes. Inside the blood vessels, when the pressure becomes more, automatically what happens? The particular heart pumping becomes harder. Harder pumping of the heart happens, by which it can lead to a lot of heart attacks. See, it is just like a simple example. See, whenever a reservoir or a dam is there, it can fill the water to some extent. Whenever the water level in the dam increases, automatically the dam gates, if they are not opened properly, the dam in fact eventually ruptures. The dam breaks down, because of which the water spillage happens outside. This is a similar scenario which happens in the human body. Whenever the pressure is more, and ultimately the rupture of the vessels will happen, leading to heart attacks. So blood pressure, we are seeing your blood pressure on your, the arm, which does not mean that the blood pressure is here. The blood pressure is actually seen inside the vessels of the heart. That is where the heart attacks usually happen. Not only this, abnormal heart valves. This can also lead to a lot of heart attacks. See, your heart will have something like the hinges of the door. You have a door in your house, everybody. You open and close the door. Whenever you are opening and close the door, there are a certain set of screws which are given on one side of the door. By only when the screws are proper, you will be able to open and close the door properly. I hope my point is clear to you. Similarly, inside the heart also there are some doors. When the doors are opening and closing properly, the exchange of pure and impure blood happens properly in the heart. Whenever the doors are not functioning inside the heart properly, you can eventually end up with heart attack. So not only this, heart muscle diseases are also there, wherein the inflammation of the muscles can also happen because of viral infections. This is one thing that I want to emphasize here. Now the cardiologists across the world are coming to an inference that the COVID-19 virus who has affected, one who has affected with COVID-19 might have become negative, but the virus can cause damage to the heart muscles. So whenever the virus causes damage to the heart muscles, the weakening of the muscles can happen, the inflammation of the muscles can happen, by which eventually, not now, at least 10 years or 15 years from now, the person can suffer from heart attacks. See, these are all the reasons for an ultimate and eventual heart attack to happen in a human being. So heart problems doesn't really mean that heart attack, no. There are a lot of such reasons which can lead to a lot of heart problems. Similarly, lung problems are there, severe lung disease as we call. Whenever the lungs don't work properly, pressure will be put on the heart to pump more blood. Oxygen supply is very much required for the heart. Lack of oxygen to the heart will also lead to heart attacks. Similarly, diabetes. Whenever the diabetes increases, type 2 diabetes or type 1 diabetes for that matter, diabetes can lead to a lot of blocks in the heart as well as increased blood pressure also, because as I tell you many times, diabetes and obesity are two faces of a coin. So this can eventually lead to a lot of heart problems. And lack of regular exercise. Whenever a person is not exercising properly, because of this, fat deposits, especially the bad fat deposits, it might be the low density lipoproteins or the triglycerides, they can accumulate inside the arteries of the heart, by which it leads to a lot of heart issues. See, all these are the reasons of the heart, my dear friends. This is what exactly the cardiologists across the world are mentioning about the root causes of the heart disease. So, the other thing is, one of the newest research which has come again, as I was telling you about the COVID-19. See, COVID-19 not only damages the muscles of the heart, but there is a particular element called as troponin. This increases in the blood of the human beings which have been affected by the COVID-19. Now, the tests are coming to India also in near future, that whoever is affected with COVID-19 and they have become negative, they can test the blood of those people and see the levels of troponin which is present in the blood. This can also help us understand the position or the situation of the heart. All these are the diagnostic tools. But one thing is important. We have to protect our heart at the end of the day. All these are the things which can happen to the heart eventually. But one thing is there in our hands to protect the heart, and that is nothing but our iPulse. So it can definitely protect our hearts, prevent all these problems from happening in the future. Previously, 20 years back or 10 years back, if you see, there were only 10 reasons for heart attacks. But nowadays there are 30 reasons. Coronavirus is the final reason now. So all these things can happen in the future as well. So that is the reason why we have a wonderful dietary supplement with us called as iPulse, which is a cardio-protective product which can definitely protect our hearts so that even in the future, so all these kinds of heart problems will not appear in the human beings. So I hope my point is clear to you all. This is how the wellness products with protective health benefits should be promoted in the market, my dear friends. I hope my point is clear to you all. With this, I want to tell you one thing. Disease and the root cause of diseases are two important things that you people have to speak out outside. People, every customer or every client who is interested in the product will be knowing about the disease. But the reasons or the root causes of the disease, they will not be knowing anything. That is where we have to play a very important role as wellness entrepreneurs to promote our products. I hope my point is clear to everybody. So, as you all know that iPulse is a wonderful product which contains the goodness of antioxidants. So, antioxidants are very much required for the human body. Antioxidants are very much required for protecting the heart health also. That is why we have formulated a product like iPulse with optimum antioxidants in it. So antioxidants, as you know, that they are capable of fighting out the stress. And ultimately, stress is one major element, an epicenter from which all these root causes of the diseases usually they come out, emerge out. So that is the reason why stress should be controlled first. By the consumption of antioxidants, the oxidative stress will eventually reduce. Not only this, my dear friends, oxidative stress can cause stress to each and every cell of the human body. It is not only, a gross human body. Each and every cell of the human body is affected by the oxidative stress. I hope my point is clear to you. So, now the antioxidants which are already present in the human body are very less in numbers. They might not be able to tackle this stress. That is the sole reason why we are telling that you have to consume iPulse from outside, which is considered as a dietary antioxidant which can help increase the number of antioxidants inside the body. This is what is called as the antioxidant theory. So as you all know that the most important ingredient which is present in iPulse is called as acai berry. Acai berry is botanically identified as Euterpe oleracea. This particular fruit is indigenous to the rainforests of South America, where it is considered to be the number one heart protective fruit. It is the number one antioxidant fruit for anti-aging support as well. It is having an ORAC score of more than 1 lakh. It is 1,02,700, which is relatively higher as compared to any other fruit or nut available till date. It is also responsible for destroying the cancer cells. It is a very good immune system support. It is inspired by the space drink, which is formulated by the NASA, which is used for protecting the astronauts from the radiation. It is also used for centuries as a preventive healthcare support. So not only this, my dear friends, the quantity of acai berry in our product iPulse is 14%, so which is called as a freeze-dried extract of iPulse. So the freeze-dried extract or the powder is the one which is actually made by freezing the acai berry to minus 80 degrees and then powdering it. This particular process will actually preserve the quality and the naturalness of acai berry in the iPulse itself. So not only this, the World Health Organization recommends a daily dose of 5,000 ORAC units of antioxidants for maintaining the health in a healthy person. But for getting that 5,000 ORAC units of antioxidants, we need to consume at least 3.5 kgs of fresh organic fruits on a daily basis. But is it really possible? Definitely not. That is the reason why we are telling you to consume 60 ml of iPulse on a daily basis, wherein you will get 7,000 ORAC units of antioxidants. This is very important. The remaining antioxidants, the surplus antioxidants, what we are giving you, it is stored in the liver of a human being, which is considered to be the storehouse as well as dustbin, sometimes as I call, of all the elements. It might be the good elements or bad elements. So whenever the bad elements increases in the liver will not be able to cope up. That is why you have to fill your liver with good elements always. Those are nothing but the antioxidants. So not only this, iPulse contains a variety of antioxidant fruits, starting from the blueberry, the pineapple, the pear and so on. So these are nothing but the 15 other antioxidant fruits which are present in this wonderful product iPulse. The best thing about these antioxidant fruits are none of them, in the formulation itself we have not added any sugar. In fact, the sugar which is coming out is nothing but the fructose which is coming from the fruits of iPulse itself. The 15 antioxidant fruits which are present in iPulse itself. So this is where iPulse plays a very important role even when the diabetic population is concerned, my dear friends. I hope my point is clear to you all. So not only this, blueberries, which is also present in iPulse, plays a very important role apart from acai berries. In fact, blueberries also have a wonderful antioxidant composition. These are all called as the anthocyanins or the anthocyanins, as we call in science, called as the antioxidants. Blueberries are also important for giving you the healthy bones, healthy skin. It reduces your high blood pressure. It is a wonderful diabetic management fruit as well. It protects the heart against various heart ailments. It is a wonderful cancer protection element as well. It improves the mental health. It enables healthy digestion. It is a wonderful hair care ingredient also. I hope my point is clear to you. So, acai berry has its own benefits. Blueberry also has its own benefits. So, in series of iPulse to come in the Facebook Live, I will be telling you about individual fruits which are present in iPulse, my dear friends. Now today I told you about blueberry. Even though the quantity of these antioxidant fruits are relatively less as compared to acai berry, but still they have their own wonderful antioxidant and health benefits, my dear friends. I hope my point is clear to you. So today I've spoken to you about this blueberry, which is a wonderful component present in this product iPulse, which is also contributing to the antioxidant benefits and other health benefits what I told you right now about the iPulse as well. So as I told you, iPulse is a wonderful product which can get rid of the free radicals. Free radicals are nothing but the root causes of the diseases. To eliminate the free radicals or the root causes of the diseases, iPulse play a very important role. It neutralizes the free radicals. After the free radicals are neutralized, so automatically the root causes of the disease are eliminated, by which the body becomes protected or prevented from all kinds of dreadful diseases in the future. So iPulse has a lot of cardiovascular benefits. It is having wonderful antioxidant benefits which protects individual cells of the body. It also has a lot of immune boosting benefits as well. Not only this, it improves the quality of life in cancer patients. It has very good nervous system benefits, by which it improves the mental clarity as well as the strengthening of the memory. Not only this, it is wonderful for the complications of diabetes as well. The complications basically are 4 in numbers now. Basically there were 3. One more is added now. First is the diabetic retinopathy, which affects the eyes, diabetic nephropathy, which affects the kidneys, and diabetic neuropathy, which affects your nerves. Nowadays, we also have another complication called as diabetic enteropathy, which affects the intestines. That is the main reason why people with diabetes will always have these, the loose motion issues. So even for diabetes people, you can definitely give iPulse, but 20 ml in the morning, half an hour before breakfast, and 20 ml in the night, half an hour before dinner. So not only this, it is good for BP patients, especially for low BP. It should be given 30 ml in the morning, half an hour after breakfast, and 30 ml in the night, half an hour after dinner. So age limit from 1 year onwards, you can definitely give iPulse. From till 100 years, the dose remains the same, 30 ml twice daily, half an hour before the food. So far as the pregnancy and lactation is concerned, first 6 months of pregnancy, there is no problem. After the 6 months, it should not be given. So during the lactation, the first month, it should not be given. From second month onwards, it can be given safely. I hope the points are clear to you, my dear friends. So thank you so much, Vivites, for your patient watching. I hope now you have understood the concept of heart protection and iPulse. At the same point of time, I have emphasized about one fruit in iPulse, that is blueberry now, along with acai berry. So in series to come, I will be speaking about the different fruits of iPulse as well. So thank you so much for your patient is listening. So now it is a question answer time. So let me take some of the questions which were left unanswered last week. So the first question is by Miss Manjula. If you are watching this, how to give iPulse to 10-year-old girl who has asthma? You can give 30 ml twice daily, half an hour before food, but in room temperature conditions. It should not be given in cold condition. So the next question is by Mr. Venkatram. If you are watching this, dosage of iPulse for cancer patients, you can give 30 ml twice daily, half an hour before food itself. So the next question is by Ms. Nandini. How iPulse should be given for obesity, before or after food? It should be before food itself, but if you are taking along with iSlim bar should be given in the evening between 7 to 9 p.m. After iSlim bar, give a gap of half an hour, then you can consume 30 ml of iPulse. I hope my point is clear to you. So the next question is by Mr. Shrestha Prasad. Can iPulse help in spinal cord injured person? You can give 30 ml twice daily, half an hour before the food, because for the neurological problems like the spinal cord issues, you can give 30 ml twice daily, half an hour before the food itself. So the next question is by Mr. Krishna Kishan. If you are watching this, can iPulse be given for keloid problem on the chest? No, because keloids are nothing but the outgrowths which are surgical in nature. These are the surgical problems where the surgery has to be intervened. iPulse cannot be of any help here. So the next question is by Mr. Azhar Manzoor. If you are watching this, can iPulse be given for kidney stone patients? Yes, 30 ml twice daily, half an hour before the food itself. So the next question is by Mr. Ramarao. How to use iPulse for gastric problems? See, one thing is important so far as the gastric problems are concerned. You can start with 20 ml twice daily, or if someone is sustaining it, 30 ml twice daily is also okay. If someone is complaining of gas issues after the consumption of iPulse, you need to follow this route. 20 ml in the morning, half an hour before breakfast, and 20 ml in the night, half an hour before dinner. You need to consume 3.5 to 4 liters of water on a daily basis in regular intervals. This will definitely cut down the gastric issues in the people. I hope my point is clear to you. So let me have a look of the questions of today. So my colleague Asma has collected the questions. Mr. Guru Prasad Patwani, if you are watching this, paralyzed patient, can we give iPulse? Yes, as a part of neurological problems, you can definitely give 30 ml twice daily, half an hour before the meal. So the next question is by Mr. Rohit Sheikh. If you are watching this, 72-year person with kidney dialysis problem and high sugar level taking insulin, can we suggest iPulse or iGlow, or iPulse or how? Okay, Mr. Sheikh, if you are watching this, dialysis is one area that you need to be very careful actually. So in dialysis cases, normally on the day of dialysis, none of our products have to be given. Suppose if the person is actually consuming iPulse on a dialysis case, normally what should happen is, they in a span of 1 week, suppose if there are 3 days of dialysis happening, on those 3 days, this particular iPulse should not be given. Remaining days, iPulse can be given safely. So on that particular day of dialysis, this should not be given, my dear friend. I hope my point is clear to you. Otherwise, in case of diabetes, since the patient is on insulin also, I would suggest 20 ml of iPulse in the morning, half an hour before breakfast, and 20 ml in the night, half an hour before dinner. iCoffee black must be given along with iPulse. iCoffee black must be half sachet in the morning, which is before breakfast, and half sachet in the night before dinner. But both the products should not be given on the day of dialysis. Remaining days, you can definitely give it without any problems. I hope my point is clear to everything. Yeah, the next question is by Mr. Muhammad Abdul. If you are watching this, what is the role of resveratrol in iPulse? See, some of the fruits like grapes, we are using 2 types of grapes in iPulse. One is the concord grape, the other is the green grapes. The grape skin as well as the grape seed contains this wonderful resveratrol, which is nothing but an antioxidant. It is nothing but an antioxidant which will give you the best of the best antioxidant benefits only in the body, which is also related to the cardioprotective benefits or the heart related benefits. So the next question is by Mr. Divyashri. iPulse can be given for nephrotic syndrome. How to consume this? You can give it at a dose of 30 ml twice daily, half an hour before the food for better health benefits. So the next question is by Mr. Anand Kumar. Can iPulse be used for treatment of varicose veins problems? Yes, but in varicose veins, please do follow this particular principle. 20 ml in the morning, half an hour before breakfast, 20 ml in the afternoon, half an hour before lunch, and 20 ml in the night, half an hour before dinner should be the dose for varicose veins. I hope my point is clear to you. So the next question is by Mr. Guru Prasad. Premature baby, can we give iPulse? No. iPulse should be given from 1 year onwards, not below 1 year. So I hope my point is clear to you. So the next question is by Mr. Keshav Kahane, if I am spelling your name right, sorry for the pronunciation, by Mr. Kahane. PCOD and PCOS case, please tell which product to be used. For polycystic ovarian disease or PCOD case, I would suggest a combination of both iCoffee creamer and iPulse. iCoffee creamer must be given at a dose of half sachet in the morning, half an hour before breakfast, and half sachet in the night, half an hour before dinner, whereas iPulse should be 30 ml in the morning, half an hour before breakfast, and 30 ml in the night, half an hour before dinner. The first product should be iCoffee, leave a gap of 10 minutes. The second product should be iPulse, then you should have your breakfast and dinner in the night. I hope my point is clear to you. So the next question is by Miss Nisha. If you are watching this, can we use iPulse in SLE disease? Wonderful question. the autoimmune problems. The autoimmune diseases basically are conditions where your body is fighting against your own self, with your own systems actually. In such conditions, you have to give iPulse in the following way. 30 ml in the morning, half an hour after breakfast, and 30 ml in the night, half an hour after dinner. It should be after food in case of autoimmune diseases like SLE, psoriasis, rheumatoid arthritis, type 1 diabetes, and so on. I hope my point is clear to you. So the next question is by Mr. Kiran Basroor. If you are watching this, can iPulse be good for fits patient? As a part of neurological issues, I would definitely suggest this at a dose of 20 ml in the morning, half an hour before breakfast, and 20 ml in the night, half an hour before dinner. Why I am telling you this is epilepsy or fits for that matter. See, there is no proper reasoning for this epilepsy or fits even today. It might happen because of excess pressure, stress, drugs, or medicines, because of genetics and so on. There are lots of reasons are there, but no specific reason is there. And the episodes of epilepsy or fits can happen anytime and every time. Whenever you are giving 30 ml of iPulse on regular basis, there is no relationship between iPulse and epilepsy. In the sense, iPulse will not increase the episodes of epilepsy. No, there is no such study or no such side effect which is reported till date. But people might think sometimes that once or twice, if the episodes happen, they might attribute that epilepsy to the product itself. That should not happen. That is the main reason why for epilepsy, continuous use of epileptic drugs, anti-epileptic drugs is very important, along with the use of iPulse. So you should not tell them to discontinue the product, but along with the product, if you suggest them to use this, definitely the wonderful results will come, my dear friends. I hope my point is clear to everybody. So the last question of the day that I am taking here is by Miss Banu, if I am spelling it right. iPulse for genetic disorder, muscular dystrophy problems. Again, as a part of genetic disorders, medical science clearly says that it is genetic disorders. Genetic disorders can flare up anytime. But still, as a part of antioxidant, I would definitely like to suggest this in muscular dystrophies, both for children as well as adults. You can give the iPulse in 3 divided doses in a day. 20 ml in the morning, 20 ml in the afternoon, and 20 ml in the night, half an hour before the food. 3 times 20 ml if you are giving it. In a case like muscular dystrophy, the beneficial results are there because more and more antioxidants push will be there. I hope my point is clear to you all. Vivites, there is a link which is appearing at the end of the chat box where you can click and pose your queries so that we can get your queries answered. So thank you so much, Vivites. That's it for the day. This is Dr. Balu Kolar, Head of Product Development and Training, signing off from the desk. Have a nice day ahead.